Are you curious about what it's like to go to a dentist in El Salvador? Well, we were too, and we really had to go because my kids really needed a dental cleaning. We've been here 8 months, and we normally get it done every 6 months. And my husband just happened to break out a filling the other day. It took out some of his tooth. We really had to get that looked at in case there's going to be any infection or anything. Now, we just went to the dental office right next to us in the Pasatiempo Mall. It's Verber Clínica Dental, and I wanted to go to this one because they not just have a dentist, they also have an orthodontist. And because Willem was in the process of going to be getting braces while we were in Canada, we wanted to finish that process and actually get him some braces. So I was really happy that we get to see the orthodontist as well today. Stick around to see that at the end. It's very interesting. He doesn't have an assistant that helps him out? I guess not. Never been to a dentist with an assistant. So for each of us, he actually put his hands on our jaw and felt around to make sure that our bite was correct and our jaw was opening correctly.
You need to break it. Yeah, you have to break it apart and then get a new teeth.
Okay. Yeah.
We'll clean you up right now, and so it will be extraction, then wait 2 options. For a breach, whatever that is,
a bridge, yeah.
2 months after doing the extraction,
right.
Or redo the tooth after 4 months. 2 months or 4 months.
With an implant or a bridge, huh?
But that's after extraction.
So what do you want to do, hon? You want to do the extraction?
Now?
Like can we do it today?
Or you want to let it break through?
Because it's going to hurt awful bad. It's on the root. He says the root's exposed.
Do you want to do the extraction right now?
Well, I think you should do the extraction right now because either way you got to get that out and then you get the other option later. Okay, see, extraction. You don't want freezing, right? I don't think GJ wants anesthetic.
Dice que sin anestesia lo puede hacer.
Like a Novocaine or something. No.
Entonces sí tiene que tener anestesia.
Sí o sí.
Yeah, he needs anesthesia.
Okay, you need anesthesia.
You remove everything from the root up. It will take the root up. So you need anesthesia.
Yeah.
Yeah.
So anesthesia, okay.
Yeah. Otherwise you want to cry like a baby.
I've had stuff done without anesthesia.
You've had
You
fillings
sure?
and stuff.
I don't like anesthesia because it really wrecks my face for several days.
Just make a great video.
He says he can't do it.
Oh.
You're gonna cry.
You're going to cry too much.
Has to. Otherwise you need to go to another doctor. All right.
All right, you get it? You'll take the anesthesia? Okay.
Sorry.
Okay.
Yeah.
Si quieren jugar.
Is it working?
Oh, yeah.
Yeah, trabajar, sí, funciona, yeah. It's working. So as you can see, we had a little bit of a debate about whether we would get the tooth extracted based on the anesthesia. In the past, GJ has done lots of dental work without any anesthesia. It's not really very common in the Netherlands. And even my own kids have had fillings done with no anesthesia. Only Lawrence has really ever been under anesthesia, and some of his work was even done in the Children's Hospital in Canada. So the biggest difference I found with the cleaning was that in Canada they normally use the tools to scrape off the tartar and the plaque, and they kind of pick around your teeth quite a bit and measure the distance between your teeth and your gums to see if they're receding, and then they will use the polish after that and they floss. This dentist, and I think most places here in El Salvador, they use a sort of a sonic tool. It's sort of like a little mini drill, and there's some water spraying everywhere, and they use that to clean off all around the teeth and between the teeth, and then they do the same sort of polishing that we would have in Canada. Also, the other difference is they never asked if our kids wanted a fluoride treatment or if we want to give them a fluoride treatment. That's something they typically ask in Canada, and they have not done that here. I did a little tour around the office here. You can see their machinery. There are 2 dentist offices. One is really for the orthodontist right here, and that's where we sat down with Willem afterwards, you'll see. And then this is this dentist's chair here. And there's no actual help for them except the receptionist. Normally, all of our dentists have dental assistants. and they're always there passing the tools and whatever. This guy did everything on his own. So I can say that is really the key differences. I guess in this case, you pay less for labor because there's fewer people there. And they do all the x-rays here. You'll see that we do those in a bit. They have two types of x-rays. This is the panoramic 365 there in the distance. And then in the foreground, there was one, and you'll see Willem use it later, and it does something with the side of the head to kind of figure out how much space he has for his braces. And these are all the molds of the teeth they've done in the past. Kind of crazy, see them all just lying around there. This one here is your regular typical dental x-ray, it looks like, that we would normally have seen in Canada, but they have another one of these around the corner from between the two dental offices. Really, there's one right there. So I'm not sure why you would use that other one. It seems a little different. And then right here is where we met with the orthodontist later on at the computer. You'll see that in a minute if you stick around and see the end. And you definitely want to stay to the end because that's where I talk about the cost breakdown and compare it to what we would have paid in Canada. So this is really important to know.
How do you feel the anesthesia so far?
Is it frozen?
I feel it's there.
No, but he has another needle if...
Le va a poner otro.
Sí, refuerzo.
You want to do another shot, but I told him you're fine with that one.
It's fine.
Okay.
I've had extractions on without anesthesia. It's fine.
And then the other ones, if they don't use anesthesia for fillings or anything, like in Canada, you get a feeling that, hit the needle in
Do
you.
it for every.
You sure you don't want the second shot?
I'm sure.
Okay.
If he cries, I have it on video.
Molesta aquí.
Does it hurt?
No. Y ahorita vas a sentir fuerza.
Now you're gonna feel a lot of force right now.
So as the dentist was extracting this tooth, I was really surprised by the tools that he had used. They looked more like an awl you'd use to make a hole in a piece of leather or whatnot. He had two different types of those, and he had his mirror, of course. And he did have some pliers, but he didn't really use those to near the end. I think he had two different sizes even. Here is the first piece of the tooth. Another thing that surprised me was how much time it took to get this tooth out. It actually was broken into three pieces, the crown at the top and then the two roots at the bottom. Here's the second piece. As you heard, the dentist was going to refuse to remove the tooth without any anesthesia, but he was still quite apprehensive because GJ only took one of the vials. At the end, the dentist took this syringe with this cup of liquid and was squirting it into GJ's mouth. He had bent the needle to do it at an angle. Dan told GJ,
That's vodka,
vodka. Of course, it wasn't vodka, but we're not sure if it was an antibiotic or if it was to stop the bleeding. But he packed it with gauze and told GJ to remove the gauze 30 minutes after the appointment. He also could not have any solid food today, only liquids. All bits of it.
2 roots.
And that was the tooth was
Y corona.
Corona, yeah.
The crown.
The crown, wow. That was a big tooth. You were missing part of it. Next on the list we had Lawrence, and he actually diagnosed Lawrence with enamel hypoplasia. Nobody's ever said that to us about the enamel being weak or thin, and we have to look into this because it's something that's really serious, I think. The dentist mentioned having more food with collagen and or calcium, but he said collagen is what makes the calcium, I think, if I understood that correctly. So we'll definitely look into that. But he did it like a champ, and no struggles there with Lawrence. And then we have Anneke, and she had no issues at all with her dental exam, and she's doing great. So with Willem, we were on track to get braces in Canada. He'd actually been seeing an orthodontist since he was 7. We got to have a consultation with the orthodontist here.
Like a model impression, we call impression.
Oh yeah, see.
The position that he has already. You know? And we have to take this X-ray, it's a panoramic X-ray, and cephalometric X-ray.
Oh, okay.
We want to see
The alignment, yeah.
exactly how
Yeah.
open are the teeth, and we have to know how the space that we have for move the teeth.
Right.
Okay. After you will call again and say, okay, this is William, and we have to do this.
Right. So we looked into Willem's mouth and get the right size trays to do the impressions.
I'm pretty sure it's gonna be a voiceover.
How right you were, my son. So after the consultation, we went ahead with getting the impressions done. And then we get the panorama x-ray done and the cephalometric x-ray done.
We're gonna see tears and cry.
Yes. Yeah, every time. Después 3 años. 3 años.
3 años.
13 años.
13 años.
Yeah.
Tiene una crestación en la articulación cuando es un chasquido, un only clap.
Yeah, every time.
Pero este crack, 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 crack. Entonces adentro es el daño, adentro de la articulación.
So there might be some articulation damage.
Since I had braces when I was 13.
Oh, desde los 13 dice que tienes.
Yeah. Yeah, I've had that problem with my jaw cracking since I was 13 years old, and there's been no dentist who's been able to fix that, so we just gave up on that. That's okay. My teeth turned out pretty good, and I had a really good dental cleaning. Very satisfied with the service today.
Todos los rayos, ¿sí?
Sí. ¿A nombre de quién es la factura?
Charity Hagenard. She'll do two,
2 bills?
yeah, invoices. One
Two
for
invoices?
the X-rays and the other one for everyone's
Okay. Sure.
work. So it's 100 for all of you guys, but JJ. For JJ is 25 plus 40, 65.
Okay, yeah, that makes
Yeah.
sense. Yeah.
165 plus the 60 of the
$25 of cleaning plus 40 for his removal. So
Exactly.
165.
Yes.
And then the x-rays for Willem will be 60. Okay. 1, 20, 40, 60, 81, wait, got 120, okay. 225. So in Canada, I had medical and dental insurance because of my government job. And the dental insurance was 90% coverage with 10% that I had to pay. And when I was looking at the prices, what it would have cost me in Ontario if I would not have had insurance, that's anywhere between $1,600 and $2,600 Canadian, or $1,200 to $1,900 American. And I paid $225. Incredible. It is almost the same as having medical insurance.
Don't forget to hit the like button.